today, and just wanted to get your like for most people that I speak with on Healers of Perth, a lot of the services that people provide, I don't even know anything about. And as a physio, it's for me trying to understand like what other available services are there that can help solve problems that I can't personally
Mhm.
do. So I just wanted a bit of, I guess, your thoughts on what is IV therapy.
Well, exactly that. And I'm just going to go back to when I first discovered IV
Mm.
therapy because I was really sick in Bali, the typical Bali belly, embarrassingly enough. And I was just Googling anything to make me feel better. And I came across IV infusions. And I was a nurse at the time. I'd been nursing for about 2 years. This was 5 years ago. And I knew that the science behind it makes sense in terms of like rapid rehydration and all of that sort of stuff. So I went and got an infusion and I was like, this is an absolute game changer. Like I just instantly felt better. And for someone who couldn't keep anything down and anything that I tried to take, I would just vomit back up. I was like, there is a real spot for this in back home. And then when I came back to Australia, I had a look into it and there wasn't really anyone that was doing vitamin infusions. So yeah, that's how I got into it in the sense of like I didn't really know what was out there and I just looked into it myself and knowing like I was a nurse at the time and I still didn't really know much about it.
Mm.
Um, I've completely derailed the question.
No, not at all. So the IV stuff, so for you, you had like the actual personal experience of just being desperate for a solution of
Yeah,
some kind, then finding something like, well, as a nurse, we give saline solution and mix of bags to people just to rehydrate and help them. So
yeah,
if I can't hold anything down, it makes sense that, well, at least get myself hydrated should help whatever's going
yeah,
on, right?
yeah.
But then do you have any idea what sort of vitamin, like so they did it in
They did an
vitamins with you as well?
infusion. Yeah, I had vitamin C. I had, to be honest, I can't really, I know that I had B vitamins because
Okay.
I asked specifically for them.
Yep.
I had some IV paracetamol. Um, but in the infusion itself, it was definitely vitamin C and B vitamins, and I can't remember what else they put in there.
So,
Um,
so you were able to actually opt in for certain elements within the IV
yeah,
infusion as well.
yep. So, when you, and I mean, they offer packages there, but I think just with my experience, I requested a couple of things which
Yep.
they were able to tailor the infusion. And the same as when I have clients that come in, I offer packages, but I often tailor my infusions to the client so that we can target exactly what they want.
Have you been back to Bali and had another IV over there since?
I haven't because I hadn't been back until I'd sort of started doing my own IV infusions, and now I can do them myself. I've got the luxury of doing
How
it
handy.
myself. So yeah, no, I haven't.
So when you were saying that when you realized for you that that just helps so much in a time of need, whereas the typical advice, I guess, would have just been bed rest and try and get some water down and whatever else, right?
Yeah, yeah. I think, to be honest, like, yeah, that's exactly it. But what that sort of opened my eyes to is that we have this huge space. It sort of just got me thinking about what else we could use this for. And I think I very quickly discovered this massive gap in preventative medicine in modern medicine. I think you're either well or you're really unwell. And I don't think that there's much of this sort of in between space where we're actively working to keep ourselves well, you know? Like so many people don't go to the doctors until there's something wrong and
Yeah.
then you're on prescription medications or you've got, you know, whatever it is. We're diagnosed with something that we then have to treat rather than doing these preventative measures before we get to this space. Um, so yeah.
Which I totally agree with as well. And I think economically, it also makes sense. I mean, if anytime we've looked at preventative healthcare, particularly in early childhood, the savings that you make across the life of not dealing with chronic conditions is obviously it's going to be quite large.
Yeah.
But it's always hard as well for someone to maybe put up cash for something when it's preventative, when you don't, the problem's not there.
Yeah.
We all know what it's like. We all just go, life's busy, and we move on until something's enough of a problem.
Yeah.
We finally have to deal with it. But the preventative space, I think, it's got nothing else to do but to grow,
Mm.
right? And I think the future will become more and more common for people to start to try and figure out how to stop ourselves getting to the doctor. Not
Yeah.
that we don't want to stop using doctors
Yeah,
or
of
anything like that,
course. Yeah. There's a time and a place.
but you ultimately, no one wants to go see a doctor.
Yeah.
It's not good
Yeah.
when
Yeah.
you're having to go see a doc.
Well, like I've even had like I've got one client in particular. She called me up and she was like, "I am so sick. I've been sick for about 6 weeks. Every time I get slightly better, I just get sick again." She's like, "I can't even get myself to work." So she initially came for a one-off infusion to boost her immune system, and she walked in symptomatic, walked out with very minimal symptoms. Like she felt so much better straight away. And she religiously comes and sees me every month now for an infusion. And her thought process is, Britt, I was wasting more money calling in sick than what I am by looking after my health and A, feeling better, and B, I don't have to take sick days. And she's like, it's actually more cost effective for me to invest in my health.
And I also wanted to quickly jump. That's very cool as well. I wanted to jump back as well. So when you first tried to bring or start to see how this is working in Australia, were there difficulties? Were there barriers with starting something like this or trying to figure out how to make this work?
So when I moved back, when I came back from my holiday, I wasn't living there. But when I came back and I looked at who else was doing it, there was very limited clinics that were offering it in Australia. So to be honest, I did sit on it for a period of time, well, for the last 4 years. And I was slowly doing more and more research, looking into it more and more. And my partner had said to me, he was like, Britt, you have been wanting to do this, just go and do it. And he's like, you've got nothing to lose. And I don't necessarily think there were many barriers in a sense. I think I was definitely worried about how people would view it because I'm very much a clinical person. Part of what I love about nursing is the clinical aspect of it. And I wanted this to be medical and to be clinical still. But I think I was worried that there was going to be this a sort of idea that there wasn't a space for these
Mm.
in in our society or in modern medicine as such. I think that's probably where the barriers more so were.
Yeah, but and why do you think that's the case? Why do you think there might be resistance against something like this?
Now this could be controversial.
Okay, we do like controversial. The audience loves controversial.
Look, I don't to be honest, short answer is I don't really know why.
Mm,
Um, I think we all are very aware that the pharmaceutical world is a business and it's very much a money making. And we see adverts on TV of Panadol and Nurofen and all of these sorts of things. Yet there are so many risks associated with overuse of these drugs as well. Like paracetamol overdose is a real thing.
mm.
And so, yeah, I think the business side of modern medicine probably has a lot to do with that.
So yeah, just to your view, there's not much of an incentive for preventative health at the moment from a business standpoint for those, I guess, that may be benefiting from the current structure of healthcare.
Potentially, potentially. But I also think just historically, like modern medicine has sort of been the way forward. And it is only, we say recent years, but something like NAD, for example, has been studied for over 100 years.
Mm.
It's just sort of the last 2 decades that it's really been studied for its benefits on aging and preventative health and overall health rather than what it was initially studied for 100 years ago. So I think advances in technology and knowledge and science and all of those sorts of things, we are seeing a shift into, sort of towards this preventative space. Um, but then it's like anything, there are lots of people out there that were taught that modern medicine and prescription medications were the only way, and we do get fixated in those beliefs still.
Yeah, it's funny that that would be the case, given that we know how often the prescription medications, one, as you say, can be abused to the point of unfortunately fatalities as
Mm.
well, and how that the interaction between them all it creates a whole cascade of issues that's even difficult to know and measure ahead of time as well. And I think there is a pretty uh, I forget who said that there was a pretty significant correlation between the number of medications you are. I think it might be Gary Brecker. He was in the insurance industry, and they used to measure someone's life expectancy, and you could determine it pretty accurately based on the number of medications someone was on.
Yeah, yeah.
And so again, there's things like that where you start to think, is that world really where we want to just keep putting all our eggs in that basket? And again, for me, I see stuff like what you're doing, the preventative side of things seems to be where I think a lot of people should maybe reorient themselves
Yeah.
towards. Um, with this, the sort of vitamins that you're, I guess, using for infusions and such, is there a huge number that you could choose from, but you're choosing a select few? Are you using the most of them that are available? Like, what's your sort of
Um,
availability
so
here?
I use most of what's available. So sort of your standards in terms of vitamin C and zinc, which are fantastic for your immune system. We've got a B complex. So it's a B vitamin blend of B1, 2, 3, and 4 in it, which are fantastic for gut health. I've got B12, which is great for energy production. Selenium, amino acids, glycine, glutathione, like they are for the most part, all ones that we already know we use, they're on the shelf in the supermarkets. But we just have the ability to give them IV.
Are there some reasons as to why you might preference some infusions over others? Like, if I'm a person coming to see you, how do I know, or how do I decide what might best benefit me?
So there's a couple of ways. I always do, as you know, a thorough consult with my clients. One of the biggest things is what are you coming to see me for? Like, what do you want to target? If it's overall health, then we can do a little bit of everything. So I've got a package called the Total Reset, which has, your immune boosting, your energy production, your gut health vitamins in it. But if you are someone who has come, like I had a client this morning who has been sick for the last 2 weeks, just couldn't shake it, we really focused on her antioxidants. So higher dose vitamin C, zinc, selenium, and glutathione. If you're wanting to increase your energy, then I might suggest, sort of your B vitamins, your B12. NAD is like an absolute game changer. And I have to say, it's definitely my favorite.
Why?
So NAD, like I said, it's been researched for over 100 years, but most recently, sort of in the last 20 to 25 years. It has incredible anti-aging benefits, which we could all do with a little bit of.
I'll take a little bit of that, please. My partner
um,
would love me to have more of that. She keeps talking about my wrinkles everywhere.
yeah, exactly. Screw the Botox, have NAD. Um, But to be honest, just the overall feeling good is just something that every one of my clients reports back. So, and it is just yeah, I feel like it's definitely the one where I've had the most positive feedback in the sense that people feel like they've got more energy, they just feel clearer in terms of like mental clarity. Like I gave an NAD infusion to one of my clients and I saw her at the gym the following morning and it was 6 a.m. and she came up to me and she was like, Britt, I literally have more energy right now than I have at the peak of my day. And yeah, it's incredible.
with with uh, with things like that, am I with NAD, for instance? Is there a list of conditions that it may assist with? I remember seeing, I think it was literally the other day, I was talking because it was about endo, which is always a big conversation between myself and a bunch of the girlfriends that we all know. And so with endo, or maybe it was PCOS,
Yeah,
polycystic ovary
yeah,
syndrome. It was one of the two, and it was saying how there may be a benefit of NAD for those conditions, or one of those
yeah.
conditions. And so, again, I don't know to what effect, I don't know how useful it is in that sense, but it's one of those things where you go, oh, okay, well, if that's something that may help symptoms, all right, that's pretty cool. Is there a place I can go to, or know, how would NAD maybe affect? Does it help my autoimmune issues?
Yeah, so look, um, NAD is used for a whole range of things. So essentially, so NAD is a coenzyme, which means that it's found in every one of our living cells and it's responsible for the proper functioning of your cell. So, what NAD does when it gets infused is it helps open up your cells and it helps the repair and regeneration process so that our body can do the job that it needs to do at its best. So personally, I have endo, and since doing my NAD infusions, I give myself an infusion once a month, so every 4 weeks. Um, I've noticed definitely increased energy, but my pain and my inflammation has dramatically decreased. My cycle is also more regular, and I'm not saying that vitamin infusions and NAD are going to fix everything, because I never want to, you know, set that
Yeah.
expectation. Um, but I have definitely noticed a difference since doing my NAD. I've actually got a client who she's given me permission to share her story, but she is 30 and has chronic pain. She was diagnosed with fibromyalgia. And I initially started treating her partner, and he was like, I think my girlfriend needs this. And we'd had a few consults, and she was really nervous, I would say, to start infusions because she'd been to so many doctors, she'd seen so many specialists, she was on so many prescription medications, and she was just like, nothing is working, and I don't want this to be another thing that just sets me back. So after a few consults, she had decided that she was going to give it a go, and she's like, "Look, I've got nothing to lose." So when I first met her, she had a four-wheel walking frame. Um, she wasn't able to work, she wasn't able to clean the house. Some mornings were a struggle to get out of bed. We'd done a couple of standard vitamin infusions to get her through sort of in the process what it feels like. And then we did an NAD protocol. So that includes 5 infusions over a 10-day period. And she had messaged me after every infusion saying, Britt, I feel so much better. This is the only thing that's worked. She was on a cocktail of prescription medications,
Mm.
and lots of different agents that sort of help target different receptors, but she wasn't getting much benefit. And her goal with the NAD was first and foremost to feel better and help with her pain. But her other really big goal was to try and get off of her prescription medications. And again, this could be controversial, and I'm not telling anyone to come and get an
Mm.
NAD infusion and we'll get you off your meds, because that's not my place at all.
Yeah,
Um,
all the caveats that need to be said, all the caveats. Go talk to your doctor, all that sort of
yeah,
jazz. Obviously,
yeah, yeah,
from experience here, but yep.
yeah. But yeah, so she now comes in for her maintenance infusions, which is once a week. She no longer uses a four-wheel walker. She went and played a golf competition the other day. She cleans her house. She is cooking meals for her and her partner. She honestly looks like a different person. Like, she is just glowing, and she's like, Britt, I've never felt this good.
Wow.
Yeah, and she is definitely that client that will always hold a really special place in my heart, and something that I definitely feel like we were sort of on that journey together, and I got to see her at some of the highs and the lows. But yeah, she's incredible.
This is the cool thing about, doing business like this. It ultimately it's for those types of stories,
Yeah.
right? It's for
Yeah.
those experiences where that one client would make your entire business worth it,
Oh,
right?
absolutely. A
So
million times. And do you know, when I got her first message, I read it and I was like to Riggs, "Oh my God, look at this." And I was like, "This is why I do what I do."
yeah,
Yeah.
it's
Yeah.
very cool. And again, as you said before, not saying that those results are typical or expected or anything like
Yeah.
that. This is again just another option for people dealing with stuff that it may be worthwhile looking into.
Yeah.
But does someone like that, or do a lot of people come in with any blood test results or chats from doctors, or is there usually a history behind people when they come in, or
So, some people, so to be honest, I would say most people come in because they just want to feel good. They just want to boost their overall health. They're like, I've heard that vitamin infusions are good. I've done my own research and I just want to look after myself. And I think as a society, we're definitely taking a shift from, like historically, we were very much like go to the pub and drink and all of that sort of stuff on the weekends. Whereas now people are joining run clubs and their saunas, ice baths. And so, yeah, lots of my clients sort of come from that angle, but I do get a lot of clients who come, they've been to the GP, they're low in B12, they're low in their vitamin D, and they come because they know that they're deficient in something.
so they're already aware of something and they go, all right, they've done their research as you say, and they come and they get that done. Do you recommend anything for people to do prior to coming to get something like an IV infusion?
Look, if someone's coming to me with, now I'm going to say like an actual issue, and when I say actual issue, I mean they've noticed a change, or it's something that you would typically go to your GP about, like I wake up and I'm really lethargic, or I can't keep my eyes open throughout the day, or I've lost my appetite, or whatever it is. If there's something that you would have otherwise gone to the GP for, I would recommend getting blood tests for that, because ultimately we want to know if there's any underlying cause, if there's anything else that's happening.
Mm.
So that's when I would recommend it. If people are just coming in to boost their overall health and just to generally feel good, then you don't necessarily need a blood test for your first or couple of infusions. Yeah.
Uh,
But if it's something that they're wanting to do frequently, then after sort of 3 or 4 infusions, they'll go and do a blood test.
Okay, so again, it's not like you're trying to stop people from going to CGPs and doctors and things like that. It's just providing a service to hopefully help people manage their health
Yeah.
as it's suitable.
Yeah.
And you still work in hospital now,
Yeah,
right?
yeah, yeah. And that's what I was going to say. Like, I'm very much the person that says there's a time and a place for modern medicine and there's a time and a place for some alternative therapies. And I think that they complement each other really well. And yeah, I still work at the Perth Children's Hospital in the acute pain service. And it's the same as, working in the acute pain service. Like, there's a time and a place for drugs or medications, and there's a time and a place for non-pharmacological interventions. So things like distraction and all of that.
So how often do you
Sorry
see,
for someone coming in.
uh, if someone does, we can always do a little pause.
Sorry, back to
And we're back.
it.
Quick little someone knocking at the door. Um, I was just going to bring up the fact that, so yeah, you talked about that you still work at a hospital, and again, it's time and place for different things. But how many people are coming in here and they're trying to improve their health because they've got some chronic condition they've been living with forever and nothing else has helped, versus how many people are coming in just because they want a performance enhancement? Is there many people that are looking at that route as well, or
To be honest, I think it's like 50-50.
okay,
So I definitely, yeah, I would say 50-50. Um, so half of my clients come in because they've got things that they've been suffering with for a long time. They've got a bursitis in their shoulder, they've got restless leg syndrome, um, like tendonitis issues, um, long-standing injuries, gut issues is a massive thing that people are coming in for. And anyone who has a known gut disorder and those that don't, we all know, or hopefully know, and if you don't know, you will know now, that we just cannot physically absorb 100% of our oral supplements. So, where we think that we're getting our zinc or our B vitamins from foods, we're not able to absorb all of that because of various reasons. So, a lot of my clients have gut issues, and that's why they come for their infusion. So they know that they're getting 100% of that dose.
what sort of infusions might you have for a gut issue?
So it depends on what you're treating, like whether you're treating an inflammatory gut issue, so patients with, like Crohn's or irritable bowel disease or something along those lines, then you might focus on sort of your anti-inflammatory type supplements. But always with anything gut related, B vitamins, zinc is like your powerhouse for healing. Um, but yeah, it really depends on the person and then other things in their life that are influencing it. So, if you come in and you might just initially tell me that you've got a gut issue, but then I ask you what you do for work and how often you're working and any other life stresses, we very quickly work out that actually you own a business or you're just busy working all of the time. So you're stressed and you've got increased cortisol levels. So then I might decide, okay, well, let's give you something like magnesium and things like GABA, which act as a neurotransmitter in your brain to help slow down your central nervous system, which is fantastic for stress. And then in turn, our gut's going to be happier as well.
So again, you might have even people just coming in here just purely because stress is high and it helps to quieten the mind or something to that effect as
Yeah.
well. For yourself, you were saying before that you do infusions for yourself. Do you have a special cocktail for self, or
NAD and then all of the above.
yeah? So you do? Would you do like a monthly for yourself, for instance?
Yeah,
Okay.
yeah. So I do monthly NAD infusions. And then with an NAD infusion, you have a vitamin flush at the end, which has B vitamins, glycine, amino acids, and magnesium in it. Um, and like I was saying before, NAD works to open up your cells, so all of those vitamins at the end can go directly into your cells, so you get greater benefits from that alone.
Is there anything that you're aware of that suggests it's again helpful to do something like this once a month, once a year, once 6 months? Is there any sort of gauge for that, or is it really off the person's feel?
Yeah, so we say maintenance infusions are 4 to 6 weekly. And then, I always tell people though, it really is dependent on you. And when I say you, that's dependent on what you've got going on in your life, finances, time, all of that sort of stuff. Like, I'd be lying if I sat here and said it's cheap as chips because it's not, it is an investment. But at the same time, you can't put a price on your health. So,
Mm. And I think it's Brigham from the US. He made a, I think what was quite a good point about that. You're willing to spend thousands of dollars just to keep your car going a
yeah,
year.
yeah,
You're not willing to spend a bit more than that if need be on your body, the
yeah,
thing that actually transports you across the
yeah,
entire
yeah,
world every
yeah,
year.
exactly, exactly.
Um, so the IV stuff that you're doing as well, is there anything that you suggest people do on top of IV or avoid? Like, should they be trying to hydrate lots beforehand? Should they avoid eating before doing something like this?
No, like vitamin infusions are just part of your everyday life. And I always tell people to hydrate before, only because it plumps up your veins nicely.
Nice.
So it makes my job a
Do some
little bit
push-ups
easier.
before you come in.
Yeah. But yeah, just eat your normal meal. Stay nice and hydrated afterwards because, if you're dehydrated, your body is gonna really utilize all of those vitamins rather than getting longevity out of it as such. But yeah, just staying hydrated either side of your infusion. But the benefit of IV infusions is that you're getting IV hydration, so you're
Mm,
getting hydration within it. Um, there's no real downtime. We just say don't go lifting heavy objects, so don't go to the gym or anything after your infusion. Um, but yeah,
just directly straight after.
yeah. So that day,
Okay.
basically, so you can go the next day.
Okay.
Yeah.
And then what else? Is it just like a saline solution mixed with the vitamins? There, is that all it is basically?
Yeah. Yep. Yep.
So no weird nasties or anything like that in there.
No, no. And then all of my vitamins are compounded in a pharmacy in Australia, and they're all in their purest form. So, for example, my vitamin C is just plain ascorbic acid. It's not mixed with anything else. So they have to be kept in the fridge. They've only got a very short like shelf life, which is great for my customers. But then, like
Maybe
once,
not as good for the
yeah,
business
maybe
sometimes.
maybe not as good for the business. No, but yeah, yeah, it's all, and then that gives me the ability to tailor my infusions depending on my client as well.
Okay. Uh, For yourself, where do you see the IV therapy going? Do you just see something like this becoming more common, more popular? Do you see the expansion of more vitamins coming in and minerals and such like that? Like, where do you sort of see something like IV therapy going in future?
Yeah, look, I think IV therapies are definitely growing and we're seeing, more and more places pop up. So yeah, I definitely see the industry expanding
And
and yeah.
is there anyone that like can't have an IV? Like, is there reasons why someone can't do it or shouldn't do it?
So we always say, do you have any sort of liver, cardiac, or kidney issues? They're our three main sort of precautions or contraindications in some cases. Pregnancy is another one, and that purely comes down to a lack of research that supports the safety in pregnant women. So
Yeah,
I
as a general rule, you
as a
always
general,
stay away from
yeah,
pregnant
yeah,
ladies. Yeah.
yeah, yeah. And look, the theory is like lots of pregnant people would take these supplements orally throughout their pregnancy.
Yeah.
And yeah, but we just don't go there. The risk isn't worth it. The time that we use vitamin infusion or IV is in pregnancy is if they're like constantly vomiting or something like that, and we can just give them a bag of fluids, and that's okay. But the vitamins themselves we stay clear of.
Yep.
Um, yeah, and then sort of people with cardiac issues, we're just mindful of the amount of fluid that we give. So there are some patients that aren't suitable for infusions, or we may need to tailor the amount of fluid that we give them. But yeah.
Would you ever do it for kids, or have you ever, or is it must be 18
No,
plus?
so yeah, so again, it is because it's particularly in Australia, that relatively new space. We don't do it for kids, and that again is similar to pregnancy in the sense of there's just not enough literature that supports the safety in children.
So a lot of it is, you're a lot of the people coming in again probably have already done a lot of their research,
Yeah,
sort of trying to understand what they
yeah.
think that they need, and then you're just providing a lot of the look. Here's the things to be cautious of. If you don't have these, you should be fine.
Yeah, yeah. And remembering that this is a complementary medicine,
Mm,
and like I had a lady call up and was requesting a magnesium infusion. She has a known magnesium deficiency, but she was she was just telling me about the symptoms that she was having. And she was like, it's very normal for me. I always get it. I know that I'm low in my magnesium, but it just didn't sit right for me. And I'm very aware that, we're in a clinic space, we're not in a hospital setting. So I just advised her to go see her GP or go to the emergency department and they could do it there. But yeah, it's
that'd be a
sometimes yeah,
bit
again,
tough at
a
times.
time for modern medicine.
Yeah, yeah, yeah. Of course, there's always a little time for modern medicine.
Yeah,
We still don't want to give that up either.
yeah,
It's
yeah, yeah.
still pretty important. I think we've
There
already
is
touched on
some
that a
need
few
there.
times
Yeah.
as well. Um, and other than that, for your IB, sorry, your IV business itself, how long does it go for? So I come in here again, like how long does the actual treatment go for if I'm getting an infusion?
So if it's just a standard vitamin infusion, like half an hour, 45 minutes with the consult. I allow up to an hour for my bookings, but I'm a chatter. So, as you know, you'll come in. I like to get to know you before I just stick in a needle. But yeah, if it's your first consult, it's generally a bit longer. So 45 minutes, sort of 15 minutes to do the consult, go over everything, and then half an hour for the infusion. But it can go through quicker than that. Like you
Okay.
can titrate the drip rate. So you can put it through really fast or you can go a little bit slower. And again, it depends on what's in there. So if we're doing a higher dose vitamin C infusion or a bit more magnesium, then I want to run your infusion rate a little bit slower and more controlled. But yeah,
Have you ever done? This is a bit of a separate note, but have you ever done a blood test that checks for your biological age? Apparently, it's a lot of nonsense, but have you ever done that
I
beforehand?
haven't, no.
Okay, that would
I'm
be
interested.
that would be an interesting one. I've had one done in the past and said I was much younger. So shout out to Ice Cream for telling me that I was much younger
Yeah.
biologically. But that would be a fun one to try. Is as an own experiment, do a bit of NAD for a little while and actually see whether whatever markers that this biological age is based on,
Yeah.
whether that shifts. Again,
Interesting.
you'd have to look a little bit more into it, but
Yeah.
I think it's more of a marketing tool than anything else because it's the one thing I was very
Yeah.
happy to tell people I'm younger
Yeah. Yeah.
biologically,
Yeah.
doing well. So yeah,
Yeah.
I don't know how legit it is, but do you follow people like Brian Johnson?
Yeah, I've seen their stuff. I actually don't follow as such, but I have seen their stuff. Yeah.
So I know he does. He's for anyone that doesn't know, he does something called Blueprint
Yeah.
Protocol, and he's spending millions of dollars each year in order to learn how to not age and AKA not die, and try and reverse his age if anything biologically to the best of his abilities. And he's a multimillionaire, so he's got the resources to sort
Yeah.
of do it. But he, to his credit, absolutely puts everything out as about as open source as he can, and he does, I believe, quite a few different IV therapies. I can't recall exactly what
Which
they
one?
are, but if I had to take a bet, I suspect NAD may be one. I know that he's got a bunch of supplements that roll out, and NAD and I think NAC are a part of
Hmm.
his general protocol that anyone can buy into. Again,
Yeah.
not recommending, just putting out the info there as well. Given that you do this yourself, do you even bother taking vitamins and supplements now?
No, no. So, and that, yeah, like that's what I often say to people. If you are the kind of person that does invest in oral supplements, you can replace them with your vitamin infusions if you keep you know, up with your maintenance infusions. So yeah, I don't take any oral supplements anymore.
Nice. Why would you? I guess.
Yeah, exactly. I mean, I'm very lucky. I do have the luxury of the convenience.
Yeah.
Um, in saying that though, I'm very time poor, so finding time to give myself an infusion is challenging.
Well,
But
even though you're time poor, I do appreciate you at least give me a bit of chance to talk to us about this, and maybe just to sort of end on again for the types of people that might be listening to this again, they're typically just going to be looking for other alternatives. They're likely going to have been dealing with stuff for potentially months to years without finding too much of a solution. So, is there any advice that you'd give to those sorts of people to sort of leave on today, whether it be about IV therapy or not?
I think it's about anything in the sense of it's all of the one percenters. And if we can try and target all these aspects of our life, um, all of those little one percenters will add up in the end. So yeah,
Cool. Target the 1%ers.
target the one percenters.
Well, look, appreciate your time, Britt, and thanks for sort of going through and explaining a little bit more about IV therapy, guess how it works, some of the potential benefits that people might get. I think, again, this is not something that many people know exists or is aware of, but to me personally, one, having tried it, but two, to me, it just makes sense that I personally take supplements. I've done a bunch of blood tests to try and understand where might I be lacking certain areas. And for me as well, I had that 7 week on and off head cold.
Mm-hmm.
And so I again, this is not a paid promotion or anything like that, but I did have an infusion here and I did notice straight away energy was better. I still probably had a head cold for about a day and a half, 2 days. But now, again, can, is it just not a convenience? Is it just
Like a
yeah,
coincidence that
coincidence or not? Like
you're
can't say for sure.
starting to phase out
But
anyway.
again, felt really good about it. And to me, the story of it makes sense, right? We go to the hospital to get saline solution IVs purely just to try and get the body to get right from literally almost every issue that we deal with.
Yeah,
We get put an IV
yeah,
in just to help the body
yeah,
fight whatever's going on. And
yeah,
so doing that to me would make sense that, well, if we do that in hospital to help people, if you were to do it out of hospital, surely that stops us from going into the
yeah,
hospital or may help to stop us
yeah.
going into the hospital as
Yeah, for
well.
sure. That's
Yeah.
what I always say to people. Like, there are definitely people out there that are like, why would I have an IV when I can just have an oral supplement or get it from my foods? But it's like, if that were the case, then why does IV exist?
Mm,
You know?
yeah.
And why is it that when you do go into hospital in dire straits, like you've got a patient who's incredibly dehydrated or they've got blood loss or anything like that, we don't go and say, here, take this tablet and that's going to increase your magnesium or your blood levels right now. We'll put that through an infusion because we know that you get rapid hydration, immediate benefits, and 100% absorption.
To all my clients out there that are constantly not drinking enough water, if you don't like drinking water, perhaps maybe worthwhile looking at something like this. But anyway, thank you very much, Britt. Appreciate your
Thank you
time.
so much. Thanks
Sure
for
we'll chat
having
again
me.
in the future. Thank
Thanks.
you.